Listen, I am telling you that
I don't agree. I don't. No. You can't say that.
This is live, as always, on 92.5 ENUGU's Dream FM. This morning, our focus is on economic and health realities of the second wave of COVID-19. Welcome back. Since December 2020, Nigeria has continued to record significant increase in the number of new cases of the pandemic, which has pushed Nigeria into the second wave of the pandemic. So much data laid out here. But the NCDC has confirmed, however, on Wednesday night, recorded 1,664 new infections of the coronavirus disease, COVID-19, in the country. The NCDC confirmed this in its verified Twitter account, with 5 deaths were also recorded in Nigeria already. The figure was the highest ever recorded in one day since the virus was first reported in the country. Now, there are over 22 states that have been mapped out as some of the states that coronavirus COVID-19 has been present, and ENUGU is one of these states. Now, the present increase in the number of daily cases could affect the recovery of Nigeria's economy from recession, given that a second lockdown cannot be totally ruled out at the stage, as well as a possible health situation crisis. Joining us this morning in our studio is a distinguished senator, Senator Chukwuka Utazi. You're welcome, sir. Now, Senator Chukwuka Utazi is the senator representing ENUGU North Senatorial District, and he's also the chairman, Senate Committee on Primary Health Care and Communicable Diseases. So we have the right person in the studio this morning. You're welcome, sir.
Thank you so much for having me here, Jude.
It's great to have you. Thank you so much for coming through. So let's start with this, quick to the question. Looking at the COVID-19, the second wave, what have you seen differently? What made it to come back to Nigeria?
Well, first of all, I want to use this opportunity if I get to the brass tacks.
Yes, sir.
To wish, being my first interface with the public since Christmas and the New Year, I want to use the opportunity to wish my constituents in Enugu North Central District of Enugu State and followers, people who are of interest in what I've been doing, applying my trade in the red chambers of the National Assembly, to, wish them well. Not minding the turbulence of 2020. We thank God that we are alive and healthy. Have seen 2021 with all the hopes we have for this year to recover from the losses of last year. So I wish you happy New Year.
Thank you.
And then the best in this year as we commit everything in the hands of God. Having said that much, I will want to say that you see, the tendency in Nigeria and world over is that when you have a challenge, that has refused to go, the tendency that people get used to it and they just take it as normal. That they will just add this one of those things to their lives, how they just manage to cope with it. So, and therefore we have a relapse. Because people now lower their guards. They are no longer keeping to the health protocols as stipulated by NCDC. People are no longer wearing the face masks. People are no longer washing their hands regularly. People are not carrying the hand sanitizers. They are not doing all the health routines that we used to do when this menace came on board early last year. Yeah. So that was just the issue. So now secondly, is the issue that because of the opening of travels, international travels, from the endemic regions, the tendency that those people, while we are trying to grapple with the ones we already have, we are now having fresh introductions. And that has giving rise to this the new variant, the mutation we have of this virus that is very difficult to cure, and all that. So these international travels, the world will have wanted to shut down, but the economics of shutting down is not what the world can grapple with, because we are talking about the recession. All the economy world over has been grounded. We are talking of how do you come out of it, and then this one come. So to shut down the travel, the airlines from moving, most of them are already. It means that's the end of it. Many people are losing their jobs. The tourism industry is already in a comatose situation. People are not feeling comfortable again. So all these issues are the things that led to this upsurge. And during the Christmas, before the Christmas season, I made a public statement in Abuja before we vacated that, is for those of us in the southern Nigeria, especially the South Easterners, their life traveling home during the Christmas is a ritual. Everybody looks up to Christmas period and New Year to meet with your people, and interact with them, engage in several social activities, economic activities in terms of development issues surrounding their communities and all that. And I was given a travel guide that people, please, because of this pandemic, don't travel home. Send your money. All those things you want to do, you want to participate in the economic activities, you want your community to benefit from your diaspora money. Please send them home now. Just suspend the travel for now. I said all those things then, and all that. But
and people didn't really.
You didn't, because if you still go to the airport, and on the highways during the Christmas, I returned on 24th from Abuja. I knew what I went through to find my way from Abuja, going through Nasarawa, with those bridge, and I followed all those jungles, to find home. The road was so busy that you couldn't get anywhere. So it shows the heavy vehicular traffic on our place, that people were moving down to the southeast, and now they are still doing the same thing. So all these issues has, compounded this matter we have on our hand. And that's why I decided that being around home, and being in the eye of the storm, that we look at this issue, because my committee oversees the PTF as it concerns this, because it's under the communicable diseases. Yes. So we oversight what they are doing, the implementation and all that. And I said I have to use the opportunity of being around to talk to the ENUGU, that the governor of ENUGU State and the ministry, the health ministry in this place have been doing wonderfully well, in trying to stem this tide. And I want to add my voice to what they are doing, to ask our people, please, that they have to observe the health protocols, that this COVID is real. You go into the hinterlands during the Christmas season and everywhere, it is very rare to see people wearing face masks. In fact, those of us who wear it, we are the minority.
Look weird.
We are deviants, so to say. People look at you, are you still carrying this? So people don't believe that. They tell you all sorts of stories. Now, but I am here to tell people that COVID-19 is real, very real. Because I do oversights. I go to Gwagwalada isolation centers. And I know that people, for a bed space, you have up to 5 or 10 persons begging for one bed space in the isolation center. And then each time, the NCDC keep hiring houses, where they keep patients. They keep hiring. Today, this one is filled up. We couldn't get again. We start looking for houses everywhere in Abuja to get to house the patients. So it is real. I go there. I go visit the hospitals. I go there to oversight to check the welfare of those patients there, how they were taken care of. So I see things. I don't hear about them. I see things for myself. You know, and I look at also the daily records that is coming from NCDC. First thing in the morning, I see most of them late night before
it even comes out.
Before it broke out for the next day. You know, the DG of NCDC have to keep me communicated every time. You know, in the night before the next day, I will have access to the information. So I see the daily records, the way they are rising and the way they are falling. And the new cases, the treatments, the people that discharge and all that, the deaths. I see all those things. So I'm worried that you come down here, people are not serious with observing the health protocols.
Now,
it's
looking
really
at this,
serious.
Thank you so much, Senator, for what you've just said. Now, I know this, the seriousity of this issue because yesterday I spoke to somebody who told me he was diagnosed with it, and this is somebody very popular, but I'm not going to call out his name. Now, looking at the rate at which the numbers are,
and that's the issue.
Yeah.
You see, because we don't call out
names, yes, but
many people still believe
that it's not true.
It's not true.
Yes.
It's an early thing.
True.
It is not an early thing. I want to tell you, Jude, it's not an early thing. If you go to Gwagwalada, last year, I'll give you one case of my oversight.
All right.
On a Saturday, I drove to the Gwagwalada Teaching Hospital. I parked my car at a distance and decided to disguise myself to go around to see things for myself. You know, when I came there and I was interacting with people, visitors, who came to see their relations in the isolation center.
Yeah. You
know, a distance away from the isolation center proper. You know, and they were telling me that they are finding things difficult. You know, they were not feeding was a serious issue for them, and all that. You know, and I said, why? What's all the problem of the feeding and all that? They say, look, you know, that most of the issues you have in those places that the rich ones can take care of themselves, but the poor ones are not. I say, but I never agree that poor ones are here. I thought that all the rich people. I asked them, they quit. They said, no, my sister is
because
there.
It's usually affiliated with the rich.
Yes. So the other one said, my brother has been there. We can't find we're finding it difficult to feed him, and we are even afraid of reaching him because we don't want to contract the disease. So you see that the high and low. So that was when I had to ask the doctors, how do you manage these people since there is no money reserved for sale? They said they're buying food from their pockets. I gave them the little money I had in my pocket to say, no, it shouldn't be so. Yeah. Doctors, yes, do your job. Your duty is not to feed patients. Then I took the matter up, you know, with the concerned authorities to reserve certain amount of money at the isolation centers to take care of the people, the underprivileged that are there. So it's not a question of that this is the only thing. Yeah. And because we don't name names, we don't call names here, that's many people think is a fake. I think I'm coming up with it that people should start disclosing identities. We have to decide so that people will know that COVID is real. It's not doing any good hiding them. You know, in this climb here, we will hide all those things. Once in a while, we name them. Overseas, we don't hide all those things. True. This privacy thing it shouldn't be.
It's not helping.
It's not helping matters.
Looking at that, why do you think the people do not believe that this thing exists? Is it because some people actually, compare it to malaria? Some people say, okay, it's just like malaria.
It's not malaria. COVID has even while we are not trying here to scare people.
Yes.
You know, try to induce fear in them and all that. But I tell you, COVID is not like malaria. It's not like malaria. That people were doing a trial and error in using one medicine or the other to try to know whether they can solve it. Now we're having medication, even to the extent that we are talking of vaccines. When we finished passing budgets of 2021, you know, we discovered that we didn't have enough in the 2021 budget to take care of the purchase of vaccines. That led to the Senate Committee, the Joint Senate Committee on Health, to meet with the Senate President and their leadership, with the Federal Minister of Health, Dr. Hanira Osage, and all the people that are concerned, where we discussed the PTF, the coordinator, Leo Sani, and all of them that are concerned. We sat down and started looking at the budget with Minister of Finance, Budget Office, everybody that's concerned with budget making. After the passage of budget, so had a day after the budget passage by the National Assembly, we sat down with them and said, look at how do we go about this issue? How do we get money to buy vaccines so that we can help make sure that so that these Nigerians will benefit from these vaccines, so that things can work well. Because if we vaccinate as much as possible, it means that the economic activities can kickstart. People can go take their shots and then live their normal life. So this issue of whether that this is malaria or not is not. So the COVID is real. It is not malaria. COVID is not malaria.
It's a different,
but it's a different ailment.
virus.
And we are working very hard to solve this problem here by trying to give medications and then to get people cured. But the most important thing that if you have the symptoms, if you give out this information early enough, it will work well for you. But if you just keep in your house hiding, you don't want to be known, identified, that's where we have the cases of deaths.
So how prepared do you think the state government and the federal government is for the second wave of this COVID-19? Seeing that you gave a story of going to some places and things were a bit tough, do you think the government is really prepared for the second wave?
Yeah, the government is serious and ready to take the issue of a second wave. But shutting down the economy, that's the danger. Mm-hmm. That's where government is not prepared for it. And I have said it in my Christmas greeting, my card I sent to people. I use this COVID issue as my Christmas greeting. And I said in that my Christmas this I sent online, that the government, did not shut down the economy does not mean the end of COVID. It means that the government has given responsibility to you to take care of yourself. Your self-preservation is your hand. That government has given you charge to take this, and then implement the lockdown yourself. Implement the controls and all that, because now it's your duty not to be moving out anyhow. It's your duty to keep to social distancing. It's your duty to keep washing your hands regularly. It's your duty to wear your face masks everywhere you go. It's your duty to stay away from the crowd. It is your duty to protect yourself. So what government has just done, because what government has done, hand over the responsibility for protection of your life and protection of your life to you. Because they have looked at the economic the realities on ground. That if they shut down, people will talk of palliatives.
Yeah.
We haven't come out from the first palliative.
Yeah.
So who is prepared for the second, for the policy of palliative? Nobody is prepared for it. The issues are still there. True. So nobody want to go into it, because if you ask people to shut down the economy, they ask you, yes, what do we eat? How do we move around? How do we manage ourselves? So government doesn't have the money. We are borrowing and borrowing and borrowing. Look at the cost of the crude. We just pegged it down for this budget at $40 per barrel. But we know that sometimes it goes down to 32, to 33. As the case may be, things are not working well. And you don't have this mono crop economy that is solely dependent on crude, that nobody is even proud to buy now. Because things are not working worldwide, nobody is using this thing, because everybody is shut down. All the industries are shut down and all that. Things are not moving. So where do you sell the crude? Our Brent crude that is the choice of most industries in the North America and Europe. Nobody is buying again. So you even carry your crude outside there. You'll be begging people to give you their vacant tank farms so that you can put them there, waiting that anytime they want to buy, you now negotiate the price. That is the situation Nigeria have found itself. And nobody is prepared for the economy. So the government didn't shut down. Things are dangerously worse. People have to be very careful the way they're doing, especially with all the people who return for Christmas. People who come from the endemic regions of COVID that are here. So people have to be very careful, watch themselves and manage themselves. Observe all the health protocols as stipulated by NCDC. And cooperate with the government of ENUGU State in all the ways they have given people to conduct the activities all the social activity. People should listen to this and listen. The government is not going to carrying whip and trying to beat people, whip people into line. Does not mean that government doesn't want it. It shows that government is humane. But government feels that the responsibility is in your hand to take care of yourself. Right. It's always good to be on the side of caution. You err on the side of caution. It's always that. Prevention has always been better than cure and cheaper. So we want our people to understand this, that you don't go. I'll tell you the story of Ebunako. Ebunako in our folk tale, is a wise animal, the lamb. And the parents ask a question: how many times will things happen to you before you take caution? One person said, one of the sheep, the lambs there, said that it has to happen 3 times. The 3rd time I will now be careful. He said, what if we don't stay up to that? The other one, when is it 2? The other one said 2. The other one said 1. The Ebunako said, no, I don't want to experience it first before he learns his lesson. He will watch from people who have already suffered this so that he become wise and protect himself. So we are asking our people to be the Ebunako in what you are doing. Stay out of it. Don't wait until you have COVID before you learn your lessons.
Sure.
Learn your lesson from what has happened to other people already. Stay out of trouble.
Thank you so much, Senator. Now, what are the concerns on the sensitization? Do you think the federal government and the state governments are doing okay at sensitizing people, most especially in the rural areas? You mentioned about Christmas. Yes. People are going about without their face mask, no hand sanitizers, social distancing. People don't exist. Do you think the government is doing okay?
Well, government is doing its own bit, because if you go watch on television, radios and jingles, they are there. But this thing should not be left alone to the government. We must take ownership. This is about our lives. This is not a government thing. It is our thing. Everybody should be concerned about it. The churches, the social clubs, the age group, cultural groups, is the duty of all these associations, all these unions, different strata of our activities in society, to caution their people, tell them that this is real. It is not just they do, they say, wait, the governor must always be saying that, or the commissioner for information must always be saying that, or national orientation agency must be saying that. It is not true. They are doing enough already.
The traditional rulers.
Yes, the traditional rulers. Is the Umuadas, the age groups. We have to disseminate this information. We have to reach out to everybody, all nooks and crannies, so that everybody knows that this is very important. Don't wait for it to happen. It's better that we are talking about it than say you are experiencing it. You are in the isolation center. It has its own Yeah, you can go there and get healed, but there are consequences.
Sure.
It's not just go there and come back and get saved. You are healed, but there are consequences of that you have even contracted it. So why do you start of it? We fought Ebola and they succeeded. HIV, stand still. We have done well with all those things. Let us also do in this. Don't just wait to say whether it's a small ailment or not. Don't get it at all.
Okay,
stay out of it.
Talking about not getting it, how about the test centers? Do you think that we have enough? Because right now, the results that we're getting from NCDC are the results of people that have been tested. Do you think we have enough test centers?
We have enough test centers now. Initially we had that challenge.
Okay.
Because I remember when we reviewed the 2020 budget, we made sure that all the teaching hospitals have enough. I remember when we had this issue, I took it up to make sure that the teaching hospital, the UNTH here,
okay,
we have to get in touch. The DG of NCDC, Dr. Chukwuka, and all of them, we concerned ourselves. First of all, we started with Ebonyi, but now ENUGU, all the teaching hospitals. We went back again, and then decided to get molecular labs. We made more approvals, which we did in the budget of that revised budget. The 109 senatorial districts in the country, that each district will have a molecular lab. So we did that to ensure that you don't have any case of anywhere you go that didn't. And then we'll further reviewed it, that all the 109 constituencies may not have the teaching hospital or the health institution to have such things. When I said divert all those things to teaching, this 109 to the 54 teaching hospitals in the country. And as I'm talking to you, that project is ongoing everywhere. That carrying all the CMDs are having these molecular labs further added to the ones already they have. So the issue of not having the labs is no longer the issue. The issue is the willingness of people to even go there. That's the issue. Now, with the second wave, government has allotted the state governments to open up the isolation centers. You know, that the thought that has closed. Open up and do all those, keep all the staff that are supposed to man that area of health to be there to make sure that things work well for people. So these are things that don't. But the only thing is that we're asking people, don't get involved so that you will even be isolated and be handled. Stay out of trouble. Stay out of contracting this MA by studying healthy, eating healthy, observing good health habits. You know, drink a lot of water, you know, in your system. Eat the healthy diets that can make you hale and hearty, that can keep you hale and hearty. These are the things we are asking our people so that things can work well for our people. Once we do all those things, it will be rare for us to contract this ailment, you know, so that we have a healthy populace that will guarantee a working economy.
All right. Now, before we start picking the phone calls, ladies and gentlemen, you're listening to 92.5 ENUGU's Dream FM. And in the studio today, we have the distinguished Senator Chukwuka Utazi. He's a senator representing ENUGU North Senatorial District, and he's also the chairman, Senate Committee on Primary Healthcare and Communicable Diseases. And today, we're looking at the second wave of the COVID-19. Now, real quick, I want to find out this. People have said a lot about this vaccine. Some people said that they're trying to kill Africans and all of that. So people have this mindset about the vaccine. What have you got to say about this, seeing that you are the right person to ask this question?
Well, you see, we have a lot in the social media.
Yes, we do.
A lot, so
a
much.
lot.
Those anti-vaccine
Yes.
and those for vaccine.
Some said it's G5, 5G. Right?
Oh, yeah, 5G. There are all sorts of allegations.
Yeah.
But what I tell our people is that there's no country that can stay there and watch its citizen being killed, you know, for any reason. The awareness about even those people, the protests against that, is enough reason to put everybody on watch. You know, so we are following up. The vaccines you are getting is not the one you just stay here, they send it to you. Everybody following everything to the company, seeing what they're doing there and how they're administering it. That you see very high, the very important personalities in all the climes, you know, submitting themselves for this shot shows that it's real. Okay. People are aware now. It's no longer what used to happen before. I know the fear of what Pfizer did here over time in Nigeria,
yes.
in northern Nigeria,
yes.
where they went to test this one without obtaining permission, children. Yes. And many people died in the process. It's in our minds. You know, it's there. Everybody have that. The mindset, once you just go and say, this issue
company
of Pfizer and all that,
yeah.
They have come again. But I want to assure Nigerians that we are following everything. Everybody is cautious. What we are doing is, what we have in place is cautious optimism. You know, that's what we have. Yeah. Everybody is cautious. We are following things, looking at things, checking everything. Also know that the NAFDAC is working. It's firing from all cylinders. The lady that is in charge of the Professor Day and her team, they are not relenting. And in the last meeting we had, when we were talking about the procurement of this vaccine for the country, we discussed this issue. We told her that she's not, for purposes of this thing, is not taking so much instruction from the Minister of Health. Because it's a regulator. Yeah. You know, that you are working out of it. We don't want you to be too much under the Federal Ministry. So we want you to look at everything the Federal Ministry is doing as a concern the purchase of the procurement of a vaccine. Anything you don't understand, just raise alarm. Let all of us look at it. So everything, all of us are geared towards it. We are not just waiting that somebody will do it. No, we have considered ourselves as a team working with the health ministry to make sure that things work.
Someone called and said, did coronavirus go on break? That was the first caller. That how come it's coming back now?
No, my friend, I want to tell you that coronavirus did not go on break. You know, what happened is that many people resorted to self-medication. Many people now decided that since they talked about chloroquine and all that, you know, everybody rushed to hospital. Yes, rush and started buying one form of a drug after another, trying to use them and all that. That's not it.
And there was also social distancing.
Yes.
People were using hand sanitizers.
Yes, that's just it. So many people were doing that. And then another issue is that many people were serious with themselves. Because if you are working very hard to get things done, to protect yourself, and you are positive in all those things we have asked you to do, the tendency is that you will not have the ailment. You know, so we are not begging that people should get ailment in order to get. No, we say what we are advocating is that everybody should stay safe and protected by observing the health protocols as stipulated by NCDC. That's all. Once you do that, you start out trouble. You know, but what we are saying that this second wave is as a consequence that, yes, we open the economy. People are traveling. You know, our people travel a lot.
Yes, we do.
You know, our people travel a lot. The other time, we locked the economy and locked all the air travels and all that. The lockdown affected them. And then we were able to contain things. Now we opened up. You are having influx of people there. That's the consequence. You know, so government, yes, they have this trouble. Look at the United Kingdom. They locked down certain parts of the northern and the southern part of United Kingdom. Totally locked down. You don't go anywhere. But the BA still comes to Nigeria and goes.
Yeah.
You see the danger. You know, for you to get to travel outside of the country, you know, if you get to UK, you have to cross the border. And you cross the border, they take your fingerprints. And those fingerprints that are taking all the machines there are open to everybody. You don't know how people, wherever they are coming from all different parts of the country. Dito every other country. You go to any borders of the country, any foreign country, you have to do the biometrics.
True.
And the instruments you're using is used by all. So the tendency to pick these are there. You know, you go to US, they're having trouble. Many deaths are almost running 2,000 daily. And yet, they have not locked their economy. We are still having the air travels to those areas. You know, some other people have shut down UK, say they don't even want visit from UK. Has Nigeria done so? The answer is no. Some say that they don't want to take any visitors from Europe. You know, and they don't other countries outside there. But has Nigeria done that? The answer is no. So these are the issues. So these are the areas where we are having
the second
wave.
All
and then even here, you go to the airport.
Yeah.
You see, you come to the airport because we oversight the airports to ensure their preparedness and readiness to manage people who are coming in. You know, we go there on daily. We put the port health services that are there. Those are the people you see that try to test your temperature in the airport. These are the people who ask you. They wear green. This ask you to take sanitizer. You go there, you see people who ask to wash your hands. Or these port health services, you go there and ask the people, how many Nigerians, you know, that agree that once they are coming here, once they enter the country and cross the border, you ask them to do, they tell you who they are. You know, and they become very heady. You know, we have issues there. You know, that we are trying to forcefully apprehend people. Over there, they will obey their laws, all the laws outside the country. Well, once they enter here, you see them, their protocols will come in and then refuse to subject themselves to this test.
Wow.
So these are the issues that we're having. And then if you're having these people who come in without being tested,
Yeah,
is
of course,
a lot of health challenge to the country. So that's why we are warning everybody, please stay clear. That's why we haven't, the ENUGU airport has not been opened. Many people have said the international trade, we said no. You know, we open only Lagos and Abuja. And then also gave this a postdated opening this of Port Harcourt and Kano. And then the issue of ENUGU came. And when we reviewed all the issues, I told my colleague, Nnolen Naji, the chairman of Aviation Committee, we should not be, we should not be in a haste to allow the resuming international flight from ENUGU here. We know what ENUGU benefited by the closure of the airport as a consequence of the runway maintenance. So, and I told him we are not. We are not, even the one that that we are going to open is in March for that Port Harcourt and Kano. We say it is only when we watch the situation in the country, then Kano and Port Harcourt will open. So when nobody is making case for opening of the airports here in the ENUGU, I said no, we're not going to take it. So,
but why do you think people also have a feeling that there's a political undertone to all of this? Why do you think the masses feel that?
Well, you see, it's all about perception. You know, perception is everything. You know, you don't blame the citizens. A lot of expectations have always been there, and of all these expectations, how many of them has been, have been met? You know, it is as a consequence of this inability by government to meet the expectations of the people that make them to lose trust. It's a give and take thing.
Do you think palliative was one of it?
Well, the palliative, the issue, there are several issues involved, but just one of them is this palliative. Yeah. You know, that it was not properly shared and all that. We learned our lessons. Mistakes have been made. We never had a pandemic of this nature before. So, and we're humans, and we're prone to make mistakes. Government have learned from all those mistakes, and they don't want to do that again. I want our people to forget about all the issues that happened in that past and continue believing their government. Government is working hard. It is the government is all of us, that are involved. So it's not a question of say withdraw that you don't trust government, that people are playing, that this is a scam and all that. It's not true. Why are we talking about COVID? We know the implications for the health of the citizenry. That's why we are trying to handle it. We don't want to add it to the other ones, to the list of the ones we have already. We want to do away with COVID so that we will not add to the list of all the ailments that have been that are troubling the citizenry. So that's the issue. We are not saying that we forget about everything. No. Look at the budget. The health budget since this pandemic has always been 100% implemented. We are using this opportunity of COVID to look at every issue that concerns our health institutions and get them fixed. So to an extent is a plus for the country. That yes, this trouble has come here. We are taking advantage of it to look at all those issues government do not address in the past before, because they are trying to balance their budget. Yeah. We now say let's do all those things so that we never return back to the old ways again. All right,
Senator. Let's see if we can pick up one last caller before we round up the show this morning. Hello. Good morning.
Hello.
What's your name, sir? Good morning.
Hey, good morning. My name is Chukwuka. I'm calling from Sansakulu.
Okay, Chukwuka, go ahead.
I want to say, I want to give my greetings first to the guest in the studio, and also to you, Jude. And my question here is for the senator in the studio. What are they doing about the crowd that is clustered around the NIN registration centers? I think that is a disaster. Is a recipe for disaster. I don't know what the government is doing about it.
All right, thank you so much. Thank you so much, Chukwuka, for that question. Now, that's a very important one. Now, all of a sudden, the federal government is saying we should all register our SIM cards, and this is the second wave, and people are rushing to do that with the NIN. How do we deal with that?
Well, you see, it's important that we have our data updated so that we know who we are dealing with. It's very, very important. staying safe and protected is also very, very important. You know, as a senator, once you return, you see my take on this. You know what they're doing, because I have a different idea about what things are doing, about our data protection laws in the country here. I take an exception. Even the people all the agencies are doing that. To allow foreign establishments in the country, international concerns in the country to have access to the private data of citizens. I have an exception. It's never done anywhere in the world. And that's why because I have already introduced my intervention, my motion, that once you come back, we look at it. It's only the nationals that can take care of this. Because the consequence of asking international organizations to have access to our data, for me, is an aberration. It's never done. You look at all the data protection acts in all the countries outside that place, outside Nigeria. Nobody allows any outsider, no matter how so well-intentioned, to have access to you. Because with it, anybody can do anything to our people here. So that's just my concern, a different thing. But when we resume, I'm going to deal with that at the floor of the Senate. How we are going to ensure that good ideas we have will be done correctly, not using wrong methods to achieve good intentions. So that's just so. But what I'm saying, that even when you are doing this, your name at the reception center, please observe the social distancing, observe all the health protocols there. Since you know the implications, stay out of it. Don't ask anybody to be a whip chasing you around. No, government has handed the responsibility of your preservation to you. That is your duty. You know, now that's just a situation. So make sure that you take care of yourself. You're not walking knowingly into a problem that you know exists is something that is only children that do, not adults. So let us take care of our health and protect ourselves.
I want to say a big thank you to you, the distinguished Senator, Senator Chukwuka Utazi, is the Senate representing Enugu North Senatorial District, and he's also the Chairman Senate Committee on Primary Healthcare and Communicable Diseases. Thank you so much, sir, for coming to our studios to explain to our people how important it is to stay away from the second wave of COVID-19. And that's been the show today, and the edition of Political Voices. Remember to keep cool 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 voices.